Welcome to NCLEX Map, where we make complex concepts simple and unforgettable. Today we're tackling one of the most feared topics in neuro, cranial nerves, but with a twist that makes it stick forever. Let's kick things off with a question. How many noses do you have? One, right? That's cranial nerve 1, the olfactory nerve, responsible for smell. Close your eyes and take a whiff of coffee or vanilla. If you can identify it, your cranial nerve 1 is working perfectly. Lose that sense, and you've got what we call anosmia. Now, how many eyes do you have? 2. That's cranial nerve 2, the optic nerve, the power of vision. Test it with a Snellen chart or by asking your patient to read something far and near. If vision blurs or a field disappears, that's cranial nerve 2 telling you the message. Now pay attention. Cranial nerves 3, 4, and 6 are all about the eyes. They are movers. Yes, they are your movers. Cranial 3 opens the lids, constricts the pupils, and moves most eye muscles. Cranial 4 makes the eye look down and in, while cranial 6 moves it to the side. You test them by drawing an H in the air and asking your patient to follow it. If one eye lags or drifts, one of these 3 might be out. Now shift your focus to your face. That's cranial nerve 5, the trigeminal. It gives you sensation in the forehead, cheeks, and jaw, and helps you chew. Touch both sides of the face with cotton, have your patient clench their teeth, and test the corneal reflex. Weak bite or numbness. That is your cranial nerve 5 is tested. Now smile. That's cranial nerve 7, the facial nerve. It controls facial expression and taste on the front of your tongue. Ask the patient to smile, puff cheeks, raise eyebrows, or close eyes tightly. If one side doesn't move or droops, think Bell's palsy. Next, let's talk ears. Cranial nerve 8, the vestibulocochlear. It handles hearing and balance. Use the whisper test, a tuning fork, or Romberg's balance test. If they can't hear or sway when standing, suspect cranial nerve 8. Now we're heading to the throat. Cranial nerve 9, the glossopharyngeal. It helps with swallowing and taste at the back of the tongue. Test the gag reflex or ask the patient to swallow. If it's absent, that's your clue. Cranial nerve 10 is the vagus, the wandering nerve. It travels from your brain to your heart and gut, controlling voice and visceral functions. Ask the patient to say, ah. The soft palate should rise symmetrically, and their voice should sound clear. If the uvula drifts or the voice is hoarse, cranial nerve 10 may be impaired. Now shrug your shoulders. That's cranial nerve 11, the spinal accessory. Ask the patient to turn their head or lift shoulders against resistance. If there's weakness to do so, there is concern on cranial nerve 11. And finally, the last one, cranial nerve 12, the hypoglossal. Stick out your tongue. It should be midline, straight, and strong. If it deviates or speech slurs, cranial 12 might be affected. Let's wrap this up the easy way. One nose, that's cranial nerve 1 for smell. 2 eyes, cranial nerve 2 for vision, and 3, 4, and 6, move those eyes. 5 feels the face, 7 smiles, 8 hears, 9 and 10 help you swallow and talk. 11 shrugs the shoulders, and 12 moves the tongue. There are 12 pairs in total, each with a job, sensory, motor, or both. So next time you assess cranial nerves, don't panic. Just think of your own body. 1 nose, 2 eyes, 3 eye movers, 5 that feels, 7 that smiles, 8 that hears, 9 and 10 that swallow, 11 that shrugs, and 12 that talks, and that's how you turn neuro from confusion to confidence. If you enjoyed this lesson, like, share, and subscribe to NCLEX Map, where learning nursing is simplified, solid, and unforgettable.